right, another management question. Looks like antihistamines, steroids, antiviral, topical antibiotics, artificial tears. Yeah, so maybe like an infection type medication question. So, 32-year-old woman, she comes to the clinic. She has redness, itching, and watery discharge from both eyes for the past 2 days. She has a history of seasonal allergies, works as a school teacher. She denies any recent exposure to chemicals or foreign bodies in her eyes. On exam, her eyes are erythematous with a clear discharge, and she has a tender pre-auricular lymph nodes. No corneal opacities are observed. Vision is normal. No photophobia. What would I do? So this lady, she's been having pretty acute, conjunctivitis. I guess the question is it allergic, bacterial, or viral? Right.
Hmm.
So initially I was thinking viral or
Okay.
not viral, allergic because it involves both eyes. She has seasonal allergies, and then you have some like clear discharge. But that can also be true for a viral cause. And then because of the tender preauricular lymph node, I'm thinking more now like a infectious cause.
Okay.
Um, and then going to the answers. So now if I'm thinking viral conjunctivitis, I'm not gonna do antihistamines. I'm not gonna do steroids. Would I do an antiviral medication? I don't think so for conjunctivitis. Maybe the best step is to give her like artificial tears to like lubricate it and then cool compresses.
Okay. So let's work through this here. Um, so when I'm reading this, right? So she has pre-auricular tender lymph nodes. Sure, you can think of viral, but also she has a history of allergies. And so the way I'm thinking this on a clinical standpoint, right? If you have a kind of a mixed picture, if that makes sense, right? You have a little bit of a mixed picture, it's probably a little bit more viral than allergic. But would you agree with me that this sways more towards I wouldn't even sway it more towards viral. I'd sway it a little bit more towards allergies here. To do you I guess to what I'm trying to say is why do I think it's more allergic than viral conjunctivitis here?
Um, I mean, like for me, yeah, like the things that point me to allergic is, it's bilateral, and then she has a history of allergies.
Yeah, but how about like itchiness, right? Watery discharge that's clear. That's more gonna go towards allergy. Sure, you have like preauricular lymph nodes, right? Um, Lymph nodes, I would say, is also it's not very specific for anything, right? It just means your body is fighting off something, right? And if you think about allergies in itself, can you potentially get lymph nodes? Yeah, there's always a potential with allergies. Usually not, I would say. But if you get really, really bad allergies where your body is literally fighting off an allergen, then the allergen itself is like a virus or a bacteria. You know what I'm trying to say? But here, this picture is to me is a little bit more allergic. And even if you think it's a mix, let's say you're like, oh, I don't know if it's viral or allergies. Well, with a history of seasonal allergies, or if you have viral, right, a viral conjunctivitis, is topical antihistamine drops going to hurt this patient? That's what you really should be asking yourself,
Okay, yeah. So,
right? And to be honest, viral usually, even viral conjunctivitis can sometimes have some purulence, not always. And then when you talk about itchiness and clear, with those two together, you should really be thinking of allergies. You know what I'm trying to say? Like itchiness and watery discharge, you should be really, really thinking mainly that it's allergies. But yeah, if you have a mixed picture here, then I would say, as clinically speaking, the topical antihistamine drops is never going to hurt you
yeah.
here. You know what I mean? Because for most viral infections, just anywhere in the body, not just here. With let's say viral conjunctivitis, but what is usually the treatment for anything viral, right? It's conservative management, right? It's like observation, right?
Okay.
You know what I mean? So, I think a better answer here would be A. D is not incorrect. Okay. I mean, D is not going to hurt you, right? Because it's like, it's kind of in a sense like you're washing away some of the allergens, but the itchiness and things like that, your best choice here is an antihistamine drop. So
Okay.
it's a little bit more allergic here.
I'll be right back now.
Sounds good.
All right, I'm back, but
All right.
let's start. First meal of the day.
All right. You ready?